Hey mamas, you're listening to the Balanced Working Mama podcast, the only podcast teaching you how to balance your work, motherhood, and wellness. I am Dr. Amber Thornton, clinical psychologist and mama wellness consultant. Each week we dive into tips and strategies and much more so that you too can become a balanced working mama. Let's dive in. Hey mamas, we have another episode of the Balanced Working Mama podcast. But before we get into it, let's just check in. Well, first, before we check in, again, I want to say hello to all the new listeners. Lately, we have been getting a few new people listening to the podcast, and I've really loved that. So, hello to anyone who's listening for the first time. And then also, of course, hey, y'all, to all the guests that have been listening from day one. So yeah, let's check in because I know that a lot of y'all are like eagerly waiting for updates on whether I am pregnant, whether I've had baby girl, what is going on. And so the podcast is actually a little confusing because we are a week behind. So with podcasting, I typically record an episode 1 week prior to when you hear it. So as of today, in this moment that I am speaking to you, I am still pregnant. I am at the end of my 38th week. By the time you hear this episode, I will be 39 weeks pregnant. Actually, no, that's not true. That's not true at all. By the time you hear this episode, I actually will be 1 day shy of my due date. So I'll be very close to 40 weeks. So yeah, it's all confusing. And so if you also follow me on Instagram, you probably have a more current update on what's going on. So I encourage you to go there if you are eagerly wanting to know. But in this moment that I am recording, I am at the very end of my 38th week, and I'll be 39 weeks in like a day or two. My hope is that when you hear this, I will have had the baby, but this baby is comfortable. She wants to stay put, and it has caught me off guard because I thought she would be here by now. So we will see. I am hopeful that within the next few days she'll be here, but I don't want to rush her process. I actually cannot rush her process because it's up to her. So we will see, but let me just say, I appreciate all of you all, the support, the encouragement, the reaching out, the touching base. Like, y'all have been so phenomenal with just supporting me and showing me love, and it just lets me know that our Balanced Working Mama community is just so amazing. And I say that all the time because I see how you all support one another, especially within our Empower Wellness programs, at our retreats, even on our social media. But then to feel it for myself firsthand has been a really special thing. So I appreciate y'all so much. So let's get into today's episode. So, with today, I wanted to make some space on the podcast for infertility awareness. And I'm doing that because during the week of April 18th is actually National Infertility Awareness Week. And with that, I find that it's just so important to acknowledge the fact that while many of us listening to this are mothers, there are some of us who really have struggled to become mothers. There are some of us who are currently struggling to conceive or to grow our families or to become mothers. And I never want that to be something that we ignore, that we dismiss, that we forget about. That is a really important part of motherhood for some people. It exists within our community. And you'll hear on the episode today, myself and our guests have both experienced loss when it comes to becoming pregnant. But then our guest has experienced multiple losses and infertility. So I hope that you all will listen to this episode, especially if it resonates with you in terms of your own experience. But also, if you have not experienced infertility, this is still a really important episode to listen to because I assure you that you likely know another mama who has, and maybe she hasn't communicated it to you, or you will eventually run into another mama who has or might be going through it, and you want to be able to support her in any way possible. So, without further ado, let's get into the episode. This episode was actually pre recorded in December. So, I appreciate our guests for being so flexible and being patient for when we actually wanted to make this episode available. But either way, I hope that y'all enjoy our conversation. Hey mama, Balanced Working Mama is growing. I want to make sure that you stay connected and up to date with everything happening over here. So you don't miss any of the good stuff, head over to balancedworkingmama.com, sign up for the newsletter. You'll always be the first to learn of any new podcast episodes, events, programs, and you'll get a hello from me every now and then. So sign up today, mama, because I want to connect with you soon. All right, Mama. So we have a very special guest on the episode today. I'm really excited to have her. She's actually one of our past Empower Wellness Mamas, so it's always good to talk to her. And I want to introduce Brittany to you all. Hey, Brittany.
Hey, how are you?
Good, good. So please tell us a little bit more about yourself, but then also the work that you do.
Yes, for sure. So, I am a licensed clinical social worker and the owner of Journey to Healing Therapy. So, I provide mental health services to children, teens, and adults in a wide variety of areas such as depression and trauma, anxiety, and infertility and life transition. So, and also, I am trying to grow the brand so that I'm providing more kind of holistic healing. So, not just traditional therapy, but also a lot of other healing modalities such as breath work. So, I am a breathwork facilitator, and that tool is just as powerful as therapy, especially when you combine the two. So, I also do that. And I am a school counselor at an independent middle and high school. So,
Yes, Brittany stays busy. I've been watching your videos on the breath work. And actually it just hit me like, I should have her back later to talk about breath work.
yeah.
So we can keep that in mind because I've been seeing you do it in the videos and the reels, and I'm like, oh, I'm really interested in this. But you definitely seem to have a lot of expertise in a lot of areas. And of course, today we're going to be talking more specifically about infertility. So I really just thank you for coming on and talking with us about that, because I know that it's something that you've experienced, but then also some of the other mamas who might be listening, they probably have experienced it too.
Yeah.
And so I guess I want to just kind of dive in and ask you a little bit more about why infertility and mental health specifically really matters to you, and why is something that we should even be discussing right now.
Yes, such an important question. And really, the reason why we should be discussing it is, infertility has been seen as taboo, as something that you don't really talk about, right? Especially in communities of color. And so, everyone wants to talk about the positive pregnancy test and the growing belly and the babies, right? And not a lot of people feel too comfortable talking about pregnancy loss, child loss, not being able to get pregnant. That's super uncomfortable for people who just kind of back away from that. And so it's just super crucial to really start having more open discussions. And I've noticed, over the years, I've definitely seen that grow a lot more, which is amazing. But we need to talk more, especially in communities of color, to normalize it in a sense. So it's not like you feel like you're an alien or something is wrong with you. And then, like you had mentioned at the beginning, I do have personal experience with infertility. So I experienced 3 miscarriages back to back to back. So when me and my husband, decide, hey, we're going to grow our family, I had absolutely no idea that I would have, these issues. I have been healthy all my life. Periods have been normal and on schedule, no issues. So the fact that we had experienced this, it was just kind of mind-boggling, it's just
Yeah.
kind of what is going on. So just to kind of give a little bit of background on just my journey. So,
Hmm.
with my first 2 miscarriages, they were diagnosed as chemical pregnancies, which I hate,
Hmm.
hate that term.
Yeah.
Makes it just sound so scientific and just not personal.
Mhm.
But what chemical pregnancy is like you lose your pregnancy like at around 5 weeks or less. And then my last miscarriage that I experienced is called a miscarriage. And so what that is just everything develops like the sac and possibly your placenta, everything except for the fetus. So in some cases, maybe the fetus started to develop and then it died, or it maybe never developed, but the pregnancy, tissues and things continue to grow. So with my last pregnancy, I was so hopeful because with the first two, it was like, okay, I was pregnant for like a week or a couple days, but this, I was like, okay, it's lasting. Like, I'm fine. I'm throwing up. I can feel the cramps and the growth, all is good. And then when we went for, I think it was a 6 week scan, they were like, oh, we can't see the baby. We see the sac, but we don't see the baby. So, maybe you're earlier than you thought, come back in a week. We
Mhm.
did that and actually happened around Christmas time.
Mhm.
So that was not a good Christmas, but coming back and then they're like, yeah, no, there's no fetus in there. And actually my sac started to deform.
Mhm.
So with that, because I experienced 3 miscarriages back to back to back, I was diagnosed with reoccurrent pregnancy loss.
Mhm.
And so with that, I don't know who made this rule, but I know for my doctor, they said you have to experience 3 miscarriages before you can get tested to see what's going on,
Yeah.
and things like that. So me and my husband, we both got tested for different infertility issues and things like that. And lo and behold, like they didn't come up with anything, which that's the only time where I'm like, please let them find something wrong.
Mhm. Mhm.
So they couldn't find anything, but they're like, hey, let's put you on some like medications and, kind of track your cycle more and have timed intercourse and see if that helps, like give it a boost. And
Mhm.
so me and my husband did that for 2 months. And that was just it, nothing came of that. And that was extremely frustrating because here we are when we were doing it on our own. Like I could get pregnant pretty easily. It was just
Mhm.
maintaining it. So I was just like, I can't. At that point, it had been over a year since we
Mhm.
had been trying. And I was like, look, I got a new job. Like, let's just take a break, wait for my insurance to kick in, and then we'll start again. And as soon as we said that, I was pregnant with my rainbow baby, my son Carter. So
Oh,
yeah.
wow. Oh my gosh. Wow. Thank you for sharing your story. And it's so interesting because I remember um because like so fun fact, a lot of the women that I know now, I met online. Oddly enough, like Brittany, you and I have never met in person, but I feel like we've had so many touch points. I feel like I know you,
Hmm.
and we've talked together. We've worked in different capacities together, and we're on the podcast together right now. And so it's funny. I remember the first time that you kind of came on my radar was on Facebook, and it
Hmm.
was. I think I told you this story. I thought that you were like one of my old professor's relatives or something because you all had the same last name. So I was like, oh, this must be her daughter. And then later I was like, no, this is not her daughter. But like I just kept following you. And it was actually during that time when you were very vocal and transparent about the pregnancy losses that you were experiencing. And so
Hmm.
I remember that was one of the things that kind of kept me wanting to follow along because I was reading and seeing, that, hey, she's experienced this. And I think it was the time when you were pregnant with Carter.
Hmm.
And you had some post about, just pregnancy loss and your experience. And I just was very interested, but also again want to thank you for sharing that because that was probably one of the first times that I had really seen another woman speak very openly about that. And so it just, it always reminded me of like the strength and the courage that you had to really just be open about that. But also I'm thinking about how tough that time probably was for you. Um, and also, I know that you mentioned the chemical pregnancy. I can definitely relate to because one of my miscarriages was a chemical pregnancy as well. And I also hate that term. Like it just for me, and I don't know about for you, but for me, it made me feel like it was not a big deal.
Yes.
It's kind of
Yes.
like that thing of like, well, it only lasted so long.
Mhm.
You didn't lose a fetus or a baby, so it's not as big as some of the other losses. And no one has ever said that to me. No one has ever like talked about it that way, but that was always the feeling that I got. And so that has always been a thing of like, I experienced a loss. It's not what other people might experience, but
Mhm.
I remember kind of having a tough time with that part, like feeling so like I'm grieving this loss. But then like it's a chemical pregnancy.
Yeah, like this. Yeah, no, I totally identified with everything that you just said because I felt the same way. And I think
Hmm.
for my first miscarriage, when we went to the doctor, because I was just bleeding, like I just started bleeding and I was
Yeah.
like, no, what is going on? So me and my husband went to the hospital and the doctor was there, like nonchalant, like, oh, it's a miscarriage and it happens. And you can, start trying like whenever, like just very minimized, and so it's
Hmm.
like exactly what you
Hmm.
said, like, well, I've
Yeah.
only been pregnant for 2 seconds, so yeah, I guess my feelings,
Yeah.
my grief doesn't matter.
Right. Yeah. And I know I have more questions for you, but it just reminded me. I think there's a lot of minimizing when it comes to chemical pregnancies. I remember the first time for me, I thought I was pregnant because there was a pregnancy test that said I was pregnant. And then I started bleeding. And so I went to the hospital a little bit earlier, or I called the doctor to go in before my actual scheduled appointment. And then a nurse came in and was just like, "Are you sure you're pregnant?" And she was just looking at
Mm.
me like questioning it. And I was like, "Yeah, I had a positive test." And she's like, "Our test didn't say that." And that's, the course of the chemical pregnancy. At that time, the levels had gone down lower. And so it wasn't registering. But with further blood work, they saw that, you know, it had dipped. And it was the minimizing and the dismissiveness of it was just awful. But, with that, I want to ask you a little bit more about the actual term of infertility, because I know that this is something that you have experiences with, but then also supporting women with that. And I want to make sure that we're kind of all on the same page about what infertility even means, because I think some people think infertility and they might think a woman who has tried for a very long time and hasn't had any success getting pregnant. Other people might think infertility and think of a woman who's had multiple miscarriages, or it might be a mix of both. Can you maybe clarify for us, what should we be thinking about, or how do you define when you think of infertility?
Yes, yes, that's a very important question. Infertility is all of those things. So typically, infertility is defined as, you've been trying to conceive, have a baby for a year and it has not happened, right? And then also with, medicine, age plays a factor as well. So then they'll also say, if you're older than 35, then, instead of the year, it's 6 months of trying and not being able to get pregnant. So that is kind of the technical definition that has been explained to me and to a lot of other people. And so for me, I feel like, yes, that's important, the timelines, because you don't want to be like, oh, it's been 2 months and I haven't gotten pregnant because, you know, what am I trying to say? Due to like unpopular belief, like it is actually pretty difficult to get pregnant. Like I know, like you see in the
It is
movies,
difficult.
or like,
Yes.
some people have, like, I know people who have tried in the first month and they've gotten pregnant, but that is not the majority. So it is a lot of trying. So I think it is important to have that like time space in there. But what you said of like, is it a miscarriage? Is it not unable to get pregnant? It's all of those things. So I kind of define it as just challenges with getting pregnant, whether you can't at all, because there's some people just due to who knows, many different reasons that they're not able to or unable to maintain a pregnancy.
Okay, thank you for clarifying that, because I think even in my mind, when I would hear infertility, I always would think, a woman who has tried for a very long time and hasn't conceived at all. And you've broadened that for me, so I appreciate that. And so now I'm excited to ask you a little bit more about just the mental and emotional part of it, because again, I know that this is something that you've experienced, but then also you are very skilled in supporting other women who have experienced it. And so, I guess, talk us through some of the common mental and emotional health challenges that women with infertility or who are experiencing infertility might actually notice or experience. And I want to, just say, I think this is important because there might be women who are experiencing this, but they're not really realizing that there could be mental or emotional health challenges. And so I want you to definitely speak to what are some of the experiences that they might have to kind of help them know that maybe they might need to seek some help or some support.
Yes, for sure. That's so important. I think too, going back to the minimizing, right? And a lot of times, especially if you've experienced miscarriage kind of early on in the pregnancy, of like everybody's like, it's fine, it's so common, so then you tend to kind of like repress a lot of your feelings and kind of deny yourself that ability to feel. So a lot of times it's like, well, I don't really know how I feel. Like I feel sad, but also I feel guilty for feeling sad. So it could be a lot of things. Depression, right, is very common. And just like this sadness and this kind of hopelessness about growing your family or creating, your family. Also anxiety. That's a huge one. Anxiety, especially if you've experienced loss and then you're pregnant, I'm just kind of like, okay, what's going to happen? Am I safe? Is the baby safe? This, and that. Trauma is definitely another thing that could happen when it comes to infertility, especially if you've interacted with any type of physicians or nurses who have minimized what's going on. Or I've heard experiences about people kind of blaming, like, oh, well, what did you do? What happened? And just experiencing trauma about going to the doctor, about talking to any medical professional just because they had such a bad or negative experience. So definitely causing, feelings of trauma and just kind of being hyper like vigilant and aware. Also low self-esteem, right? When it comes to infertility, it's like, especially women, it's like these are our bodies. We are supposed to do the most basic natural thing. I see all these people on social media having babies. Why can't I? Right? So there's something wrong with me. I am not worthy. I'm not good enough, for whatever reason. I see that a lot in the clients that I work with and even within myself. So again, guilt, guilt of like, what did I do? Or why do I feel this way? And just the wide spectrum that is grief and loss, right? So it could be you feel numb. Maybe you don't know how to process these feelings, up to just, again, that depression, anxiety, worthlessness, hopelessness, things like that. So I wish I could be like, hey, it looks like this and this, but it can look like so many different things. And I think that's the importance of being able to talk about infertility, is that it's not this one stop shop. It's not this is what grief looks like when you're experiencing infertility. It could be anything and everything.
Yeah, I'm so glad you said that. And again, I'm gonna try to, because I heard you say depression could
Mhm.
pop up, anxiety, trauma. I could absolutely see how this is traumatic for someone.
Mhm.
But then also you mentioned the low self-esteem and the grief and loss. And I think this is so important because again, like you said, a lot of times women hear, oh, this is so common, but that doesn't mean that your feelings are going to just go away about it, you know.
Okay.
It's like, yes, it's common, absolutely. It happens more than we realize because there is still some stigma and some taboo about talking about it, and you still might have a very great deal of difficulty with the feelings that you experience around it, even knowing that it's common. And so I
Mhm.
think that's important for mamas to hear. But also, in my head, I was thinking, I'm glad that we talk about this stuff more because I think, it normalizes it. Like you said, it makes us realize, yes, it is more common. And sometimes just talking with another mom or another woman about it can help. But
Yeah.
also, sometimes talking to another woman or another mom about it might not be enough. And that is the time when it's like, okay, maybe I do need to seek some professional help. Maybe I do need to
Mhm.
talk to a therapist or a mental health professional about it. And that's why I'm so glad you're here to talk to some of these things, because it's okay to seek that help.
Yeah.
No matter how small you think your loss is, we're here to tell you this loss is not small. These
Yes.
losses are not small. These experiences are not small. And if you're having any difficulty with reconciling or going through what you're going through, please reach out to a mental health professional, because you absolutely need it, and that's what we're here for.
Yes. Yeah. I mean, that was beautifully said. And I think that was one thing I struggled with, which, even though I am a therapist, right? Like with my first two losses, it was that a lot of minimizing. And I didn't really tell very many people with the first two losses. I maybe told like one or two friends. I didn't tell family at all.
Mm,
Just because it was like I was trying to process it, but also I'm a very determined person. So it was like, okay, I want this. So I'm going to get my baby, and at all costs. And what happened before, like, it's just a little setback, right? And I was not taking the time to really process my feelings. I was just repressing, 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 and I had to pretend. And I talk about this in my blog, of just everything is fine, everything is great. And that was very hard to do over almost a course of a year, to just
mhm.
be like, I am great and life is great. And not even mentioning this huge part of my life that was just in my head and in my heart, like every second of the
Right.
day.
Right. Yeah. It gives me chills hearing you say that, honestly, because whenever I hear that someone feels like they have to pretend or push down their feelings, or not really, they can't be vulnerable and transparent about how they really feel, it's hurts. It hurtsful. So, I'm glad you're able to speak out about it now and speak truth to it. But I know that that was hard for you.
Yeah. Yeah.
And I know it's hard for all the other women who are listening to this and having to do that very thing. I hate that.
Yeah.
So if you don't mind, please share with us a little bit about how you work with women who experience infertility. Maybe what is your approach to working with them, or how do you support them? What do you do?
Yes. So I really am a firm believer of just kind of meeting my clients where they're at. And I have so many in different stages, right? So maybe some clients are in the midst of doing like some kind of medical intervention, whether that's IVF or IUI or some type, and they need support and being able to manage the anxiety, that comes with that process, or, the self confidence that comes with that. So really working on like relaxation techniques, that's where the breath work comes in as well. And working them through that, because it's like they have so many appointments, and so you're there, and just kind of, I give like affirmations when people are kind of going through like medical processes. So it's really good to just kind of visualize of like what you want that outcome to be, but also working through this whole locus of control, what you can and can't. And just that is the hardest thing, is just as much as you want it, knowing that that is not ultimately, like, it's not up to you. And that's super hard for people. I know it was super hard for me to let go of. So kind of the surrendering and just
Hmm.
accepting where you're at and what happened. It's not to say like, oh, if it doesn't happen, it's whatever. Like, no, you process that, you grieve that, because that is energy and time that you spend. It's a lot. Like those medications are no
Mm,
joke. So I've never gone through IVF, but just the medical interventions that I did, it is super intense, and it makes you, or made me, I don't want to generalize, like super out of whack emotionally. Like I
yeah.
was tired. I was having hot flashes. Like, what, So it's just a lot. So, really supporting them through that process. I also really help to manage the kind of grief and loss,
Hmm.
that they're experiencing, validating them. That is huge. And I know we've talked a little bit about the minimizing, but the validation that whatever they feel
Yeah.
is valid, right? If you were angry, I don't care if you were pregnant for 1 day. As soon as you see that positive on your pregnancy test, it is a
Hmm.
baby. I don't care that it's not just cells, it is a baby. You think about
Hmm.
future. You think about growing this, baby, giving birth, them graduating college. Like you think about all of that. So as soon as you see that, it's a baby. So you have a right to feel whatever you feel about
Yeah.
that. So normalizing that, And also too, I think a big thing that I've seen with my clients is just the guilt that they feel towards friends and family who are pregnant, seeing that. So also helping them to empower themselves to be like, hey, I can't go to this baby shower, right? But, really accepting why. It's not because they're hateful, it's not because they're not happy for that person, but it is
Yeah.
hurting them. It is hurting them to be around that, and they need to be able to heal. And
Mhm.
so maybe coaching up different ways, maybe they'll talk to that friend or that loved one beforehand, or whatever works for them, but just that permission for them to be like, hey, you can turn off your social media for a
Mm.
little bit. You can do what you need to do, not isolate, but you can take care of yourself, and whatever that looks like for you. And I think that's hard. That was very hard for me. I went to a baby shower during one of my miscarriages, and it
Mm.
was torture. And that was at the time when I was not very vocal about what was going on, but I was like, I need to be a good friend, but I was not present. I was not there.
Yeah. Oh my gosh. I'm so glad you spoke to that because I think that's one of the big things that women experiencing this may feel, that pull of like, I see my friends and family having babies. I want to support them and I'm hurting, and it's just that feeling of like, well, what does it mean or say about me if I can't be happy for my friend right now? And I
Mhm.
guess, what I hear you saying and what it's making me think of is like, it says that you're human,
Yeah.
like it says that you're human. It's really, really, really hard to, um, I don't know how to say it like eloquently, but it's really hard to watch someone experience something that you've just lost, right? Or
Mhm.
it's really hard sometimes it's hard to be happy for people when you're experiencing grief and loss. Like
Yes.
that's just the reality. And,
Yes.
I've heard people say, well, you've got to learn to put that aside. You have to, put those
Mhm.
away for your friend. No, you don't. At the end of the day, your priority is making sure that you are well.
Yeah.
And when you do that, then you can show up and be a good friend. And I would argue that being a good friend is being honest with the person and just saying, hey, right now I cannot. I love you. I want to support you. But right now where I'm at is not allowing me to attend this baby shower. It's not allowing me to be present when I would have otherwise been. And
Mhm.
I think it's okay to be able to do that. I've been on both ends of that actually. I remember my second miscarriage. I was hard. I had a hard time. I knew like three other friends who were pregnant, and it was just like every time I would hear about it, I'm just like, okay, I don't care.
Yeah.
And for a while, it was like, okay, well, Amber, you should be happy. And it's like, well, right now, I just can't because I'm really hurting. I'm really sad. And um, it took time, over time, those feelings got easier to manage. But there was a moment where it was just really hard to be happy for my friends because I had just had a miscarriage. And
Yes.
that's just the reality. But then also, I had a friend when I was pregnant with C3, she actually was experiencing a miscarriage. She had a missed miscarriage.
Mhm.
And it was hard for her. And, throughout the pregnancy, I didn't really have a lot of contact with her. But after the fact, she told me, hey, one, she apologized for me, which I told her she did not have to do. But she came to me and we had brunch and she said, I want to apologize because I was not as present during your pregnancy, and it was because I was having a hard time with my loss. And I appreciated her for saying that, but also let her know, like, hey, no apology needed because I understand. And I just thought it meant a lot to me to hear that from her, but also I hope she realized she didn't even have to say that, because I understood. But I really appreciated her being vulnerable and transparent. But I think it just goes to show that it's because we're human. It's really
Yeah.
hard to go through that. It's really difficult.
Yes. And I think it's as crazy as it is, like nobody teaches us how to be human. And there's so
Mhm.
many just societal expectations when it comes around pregnancy and infertility and all of that. And so I think that's probably the biggest thing is just kind of normalizing your own feelings around your infertility and what that looks like. And sometimes it is kind of distancing yourself from certain people. But again, they're like, I'm a horrible person. But no, you're, like you said, you're human. And that's kind of the shape that grief takes sometimes, is just it is really hard for you to be just this full, I'm so happy. Like you really might be genuinely happy, but it's really hard for you to be present and to express that
Mhm.
and to not feel any shame around that.
Yep, absolutely. Absolutely. I hope there are women listening to this and feeling, again, validated for how they feel, because you shouldn't have to apologize for how you feel. Definitely if you feel able to, communicate with your friend and your loved ones about why it might be difficult for you to be present. But otherwise, feel your feelings, because that's what it means for us to be human. And, I'm all about mothers humanizing ourselves. I think there's too much of society and people around us trying to make us be these superhuman people, and we're just not. Like we need to let that go. We are not superhuman. We are human. And
Yes.
that means that we're going to have emotions that are hard. We're not going to be 100% all of the time. We won't be able to show up for everyone, and that's okay. So the next two questions I have for you, I actually want to merge them a little bit, because I would love to hear a little bit more about how you sought help and or supported yourself through your experiences of infertility. But then I also want you to share with moms any tips that you might have for any woman who might be struggling with infertility today, because I realize maybe some of what you did and the suggestions you give might merge a bit. But either
Okay.
way, I would love to hear what helped you, but then also what would you recommend for other women going through infertility?
Yes, yes, such an important question. Let's see. I'm like, every time someone has asked me that, like, and it's been a few years, but it still is just like, what has helped me heal? Because I think for me, um, I'm always kind of healing from it. Like, even still, I think it impacts me in the way that I view growing my family. Like I remember talking to you and, finding out about your baby girl and all of that. But I was just thinking, like, I do want to grow my family, but God, I do not want to go through this again, and again, that locus of control, I have no control over that. But I think it's something that just it stays with you. But when I say that, I don't mean like you're super depressed, like you're crying constantly, because I know when it comes to grief, just in general, people are like, you're going to grieve for the rest of your life. And what I've come to learn is that it's not necessarily like you're grieving, like you might be sad. You're going to always think about that person that you lost, that thing, the pregnancy. But hopefully, like the healing is like you're not constantly thinking about it every second of the day. You're able to get up out of bed, things like that. So it's just like
Yeah.
a kind of ever growing process for me. But what has helped me was really just time to understand what I was feeling, time to process things, time for me to be open and honest, when I was ready to and when I needed to. Therapy was another big thing. I was so happy that I was able during my third miscarriage to get into therapy and get that, because I was at a breaking point. Up till then, I was doing a lot of pretending and repressing, and so to be able to have a safe space to cry and to just be like, why is this happening? And I don't understand this, was therapy. Oh, and I'm not just saying it because I'm a therapist. Like everybody get you some therapy. But
Yes, please.
also, I think for my spirituality, kind of I always say fighting with God, being angry and
Mhm.
allowing myself that process. I had never experienced any type of like anger towards God, maybe some petty stuff, but this was like, I remember being in church and sitting there and just wanting to cry and just like, why am I here? I do not want to be here. I'm so angry
Yeah.
at you, God, for letting this happen. Like, are you punishing me? And being able to work through that definitely has strengthened my spirituality and my love of God and all that, what that means to experience challenges and hardships and
Mhm.
how it could really help you to overcome. So I think that's a big thing too, that maybe some people might have trouble kind of understanding, is like, well, I shouldn't be angry at God because this, and it's like, no, it goes back to the human piece. Like,
Yep.
you can be angry, that doesn't mean you're angry forever. I'm denouncing God or anything like that, but it's
Mhm.
space to process your feelings and things like that. So also too, reading other people's stories. So I am a huge kind of researcher,
Mhm.
and so I know throughout that whole infertility experience, I was constantly researching, like, I need to hear stories of people that experienced what I did and seeing the outcome, seeing that it is possible for me to have a healthy pregnancy and baby. Like,
Yeah.
I need to see that. But one thing that was missing for me was I didn't see enough people who look like me,
Mm,
like I did not see enough of that. And even though I'm so grateful for the stories that I did read,
mhm.
I just needed to know, like, okay, Black women experience this too. And I know that they did, but just to be able to see it and have it super accessible and just there, and you don't have to like dig deep, and it wasn't until I was pregnant with my son that I found a few resources like Sisters in Loss and
Yeah.
other things that are amazing. Shout out to Sisters in Loss. But
Mhm.
yeah, and I think ultimately doing my blog, which
Mm,
ironically was titled Journey to Healing. This was before I was licensed. This was
wow.
before my private practice. So that's actually where I got the name from.
That's
And
amazing.
being able to just like write out how I was feeling was so cathartic for me. And just like if I was sad, I could type that and just feel this release. So
Mhm. Mhm.
yeah.
Oh, I appreciate you sharing all that, and it's making me think. There's it feels like there's a lot of commonalities in the things that really helped and supported you, and the recommendations that you're giving, and some of what I hear is, one, feel your feelings, and do it with a professional if you're able to, but then also it sounds like it was really helpful for you to hear stories of other women experiencing this, but then also to share your story. And
Mhm.
so, of course, that is something that everyone has to decide for themselves. Some women don't feel comfortable sharing their story, and that is absolutely okay.
Yeah.
But if you do realize that there can be some healing in that, and likewise, there can be some healing in just knowing, like, hey, I'm not alone. I'm not the only person going through this. Um, and I loved what you said about just allowing yourself to be angry, whether it is with God, whether it's with um, whoever. It's
Mhm.
okay to feel anger, because anger is one of those feelings that you have to feel to get to the healing.
Yes. Yeah.
So it's absolutely necessary. And I'm so glad that you spoke to that. So I have two more questions, but this one is like, I'm throwing it in here.
You
So I
throw it
can
in here.
definitely help, because I'm listening to this and I'm realizing that there's probably some moms who have not experienced infertility, but they might know women who are. And so I want us to maybe think through what could we say to them, the women who have not experienced it themselves, but they're maybe watching another woman go through it? What should they do, or what could they say?
Mm.
I know I threw this one at you, but what comes to mind for you? And I'll try to think too, because it's making me think there are a lot of women who experience infertility, and if we're close to them, we'll know.
Yeah.
But there's a lot of women who experience it and we don't know. And so just,
Yes.
I think there's a lot of, it can be hard to support someone when you know that they might be going through infertility, and or sometimes you just don't know. So I guess what would we say to the women who are not experiencing this themselves?
Yes. I think I wrote a like blog about this
Oh,
specific
perfect. See,
topic.
this is why you're the expert. You already know. I was like, "Ooh, I'm gonna throw this question at her. I'm gonna switch it up," but she already has the answers,
I was like,
y'all.
"Ooh, that was a few years ago. Let me crank it out." But no, I think that's such an important
Mhm.
question. I keep saying about all your questions because they're all important, but I know there are so many people who are like, what do I do and what do I say? And I think one of the things about grief that kind of paralyzes us is that we don't want to say the wrong thing. So we're just
Mhm.
not going to say anything.
Yeah.
And I think when it comes to supporting someone who is experiencing infertility, is to just be present, offer your presence. I am here for you. And we often say that, right? We see something on Instagram or social media, somebody has passed away, oh, we're so sorry for your loss. Let me know if you need anything. Just so you know, most likely that person will not let you know if they need anything because they're too busy grieving. So I think being present, sending them a message, a text, a phone call of like, hey, I'm so sorry. So acknowledging the loss. Don't act like business as usual. Acknowledging it and just saying, hey, I am here for you. Is it okay if I check in on you? In like a week or a couple weeks or a couple days, whatever you feel comfortable, like really seeing where that person is at. Because oftentimes we're like, well, if we talk about it, then we're going to trigger something and we're going to make them sad. newsflash, they're already feeling that way.
They're already thinking about it.
They're already thinking about it. But I think what has helped me and what I notice has helped a lot of my clients is just people just being consistent and saying, what do you need? Do you need a meal? I'm thinking about a friend who was super supportive during my miscarriages. She was actually pregnant with her first child. And she was the only person I didn't feel like I can't be around, just because she was like, hey, here, come over. They had food for us. She had sent me books, like, I think it's just offering, like, I'm here, and maybe having a conversation if that person's ready, of like, what does that look like for them? To them, maybe they want to talk about it and they just want to be able to have that space. Maybe it's like they don't want to talk about it, but yeah, giving them food or just hanging out, watching a movie, like really following that person's lead and not deciding like, okay, well, let me figure out what they need. Like, no, like we know what we need. We might not be able to voice it at the time, but again, it's just your presence, being validating, being loving and supportive, and just being present if that's what they want. Some people, they don't. And if that's the case, just also respecting that, not taking it personal, because it is not, I promise you, it has nothing to do with you.
Mm-mm.
It is really just, we have to take care of ourselves. And then, we'll come back and, wrap our loving arms around you. But just that understanding of that, hey, we still love you. We just need time.
Yep. Oh, that was perfect. I don't even have anything to add because I think you hit on so many ways that we can be supportive to women who might be experiencing infertility. And I know me, I personally sometimes, because everyone that listens to this, probably majority of people are mothers. And so they have kids, they have very busy lives. And I know me, I sometimes get busy or sidetracked, and I don't think to check in. And so one thing that I do is, like, if I know someone is going through a experience like this, or grief or loss, I just put a reminder in my phone, like, hey, check in with them in a few days. So for any, I don't know if that's helpful for any of the moms, but I know that's something that I try to do, because motherhood has made it really hard for me to be as present in some of my relationships. And that's something I'm really have been trying to work on. And I've just told myself, hey, your brain doesn't hold the same stuff like it used to, and we got to use these tools.
Yes.
So I absolutely will put it in my phone, like, hey, I want to make sure to check in with her next week. And so then my phone will remind me, and I'm like, oh yeah, let me check in. And so that's just one way, if you're finding it hard to find the time, or you're not sure how to be supportive, like Brittany said, just being present, giving people grace, not taking anything personally. I think all of that was really good to hear. Thank you so much for this conversation. I know we have to go. And so I just want to thank you so much for just talking and speaking to this. I know there are a lot of moms and women who will be listening to this, and it'll be helpful for them. And so please let us know, how can we reach out to you? Where can people find you if they want to touch base or just follow along?
Yes, for sure. So you can follow me on Instagram. My Instagram handle is journey to healing underscore therapy. I also, you can find me at my website, journey to healing therapy.com. And yeah, did I answer the rest of that question? Because I feel like my brain just went, look.
Yes, you did. Absolutely. So I will be sure to include all of that stuff in the show notes too, so mamas can check it out, follow along. And you practice in California, correct?
I do. I
Okay.
am licensed in sunny California. So yes, definitely any moms in the California area. I'm based in LA, but I can work with anyone in California. If you are interested in therapy, if you're interested in breath work, definitely reach out.
Absolutely. So mamas, if you're in California looking for a provider, Brittany is a good one. Thank you so much, Brittany. I appreciated this. I know this is going to be helpful for a lot of people.
Yeah, no, thank you so much for having me. It's, as always, awesome to talk to you, and I love the work that you're doing, and this is definitely going to be helpful to a lot of people.
Hey mama, I want to quickly tell you about the Empower Wellness Program. This is a dynamic 6-week group for working mothers who are tired of feeling overwhelmed, fatigued, burdened by mom guilt, but then also just not having enough time for themselves. This program takes all of that and transforms it into more wellness, more time for yourself,
better priorities, community with other mothers, but then overall balance in your work, motherhood, and wellness. To learn more about the Empower Wellness program, head over to balanceworkingmama.com. There you can find when the next program begins, what to expect, but then also how to sign up. Hope to see you in the next group.
All right, mamas, I hope that you enjoyed the conversation that I had with Brittany Bronson, licensed clinical social worker. She is such a wealth of knowledge and really has so much information, skill, experience when it comes to so many things, including trauma, depression, life transitions, infertility. But also, the one thing that I want to note, and that is going to be our Balanced Working Mama shout out / tip for this week, is that Brittany also is a breathwork facilitator. So, for anyone who wants to understand breathwork, try breathwork, practice breathwork, she is the go to. I highly encourage you to follow her on Instagram, journey2healing_therapy. She has a ton of videos about breathwork, explaining what breathwork is. And I'll just let you know that breathwork is basically various breathing practices that really help you to become more conscious of your breathing, better able to control your breathing so that you are more able to influence your mental and emotional health, even your physical state. We all need that, especially as mothers. Brittany participated in our Balanced Working Mama retreat in March, and she facilitated 4 breathwork sessions for the mamas in the retreat. The mamas loved it, y'all, like for real. So I really need to think of a way to get Brittany back to do it for some of our mamas in Empower Wellness program or in other spaces. But I want to let you know that Brittany also is experienced in that. And the cool thing about it is that while Brittany is a licensed clinician in the state of California, to participate in her breathwork, you don't have to live in California. You can be anywhere and you can receive breathwork from Brittany. So definitely check her out on Instagram, visit her website. But if you are interested wanting breathwork, please check her out. All right, mamas, I will talk to you all soon. Thank you for being such a supporter of Balanced Working Mama. And until next time.
Hey, Mama. Thank you for listening to the Balanced Working Mama podcast. If you love this podcast, please be sure to rate it and share it with another mama that you know. And don't forget to follow me and Balanced Working Mama on Instagram. I'll talk to you soon.